This is Radio Health Journal. I'm Reed Pence. This week, why some Americans still struggle with pandemic stress, while others embrace the new normal.
As we go back to a normal again, the brain is still activated and we're not fully out of the pandemic yet.
The long-term mental health consequences of the pandemic when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
The average consumer has got Angry Birds and Twitter and the news at the end of their fingertips on their phone. You've got to really present something that's worth taking them away from Candy Crush.
The modern craft of book editing. Then,
I don't have a boss. I don't have somebody standing over me saying, you've got to do this first, this, prioritize this, do this, do this. But the boss, how I think of it, is the music.
The balance of being a musical artist as well as your own boss. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
The United States has become a tale of two countries, one where the COVID-19 pandemic rages on, where vaccination is slow and while business gears back up, lives are still at risk. And another country where the pandemic almost does seem to be over, where vaccinations have brought life back mostly to normal, and COVID-19 might start to feel like last year's problem. However, even there, among those who've been vaccinated, for many the pandemic just won't go away. Psychologists are beginning to see long-term impacts of the pandemic. They're finding that everyone's new normal might not look the same. Dr. Luana Marquez is an associate professor of psychiatry at Harvard Medical School, Massachusetts General Hospital, and president of the Anxiety and Depression Association of America. She says an increasing number of patients are asking for help with depression and anxiety, even people who may not have struggled with mental health before the pandemic hit.
I think it's very reasonable for people to not be fully back to normal psychologically. I think what's happening for people is that for the last 14 months plus, our brain has been scanning for danger. And as so, we've been in a state of fight or flight. We've been concerned, and our brain adjusted to that state of fight or flight. As we go back to a normal again, the brain is still activated, and we're not fully out of the pandemic yet. So it's reasonable for people to still be scanning, for people to go out for a meal outside and still feel uncomfortable. And that discomfort is natural, and it's very reasonable given what the brain went through in the last 14 months.
For some people, ditching their masks and returning to work may be tremendously uncomfortable. Marquez says our means of preventing the spread of COVID-19, like wearing face masks, may have come to feel like a security blanket, and now it's disappearing.
I think we've been told, and appropriately so, that we had to social distance, that we had to have masks. And so in that way, those became symbol of protection. That's probably how the brain sort of settled and said, okay, I'm safe enough, right? We can't be 100% sure that we're safe, but we're safe enough. And now the message is different. The message is people can go back to some of the things they did before. And the brain's going to do what I mentioned earlier. The brain's going to scan and be like, is it really safe? The key here is that what I've seen is people doing a little bit more and a little bit more. And so if you go to the office once and then again and again and then again, people are getting a little more comfortable. But it's very appropriate to have anticipatory anxiety before, so feel a little anxious. And then when you get there, to still feel uncomfortable. And the important thing is just sort of experience those emotions, not fight them, and understand that that's just biologically how the brain works.
But while some people think to themselves, am I safe? Others might think, why wouldn't I be? Not everyone has chosen to believe that the virus is a serious threat. Some have rejected masks and vaccines since the very beginning. We all cope with hardship differently, and Marquise says denial may be just another way people protect themselves from painful circumstances. Wouldn't it be easy to stay calm if the pandemic really wasn't dangerous? But how painful do circumstances have to become for people to reconsider their beliefs? If you end up on a ventilator with COVID-19, could you still tell yourself the virus isn't real? Marquise says when pandemic deniers let go of those convictions, it's about more than controversy. It's like a different kind of security blanket disappears.
So broadly, what I have seen is individuals that have fought listening to science, but then had situations that they lost a loved one, for example, and had to reconsider what that looks like. And so I think for people that have gotten close enough to the serious negative impacts of the pandemic, I think they had to reevaluate their assumptions and their behaviors. I also think they're a good group of people that their protective factor is to say, I'm not going to do this. And I think for all of us, we have to respect the different opinions. I personally tend to follow science, but it does not mean that everybody does.
There will always be people who go against the grain. No matter what each of us believes, we're all figuring out how to adapt. For many, this process is bringing on serious emotional problems, and psychologists have seen this kind of reaction before after a collective tragedy. For example, studies have shown significant rates of New Yorkers still living with post-traumatic stress disorder even 10 or 15 years after the 9/11 attacks.
What I think we need to keep in mind is that 50% of people, when they go through really challenging things, are extremely resilient and go back to normal. And so I think there is a group in the population that as things settle, they will get back to a new kind of normal, but they will settle in. Then I think there is a good group of people, and the question is how many. We don't have data to inform that, but certainly individuals that had vulnerabilities before, so individuals that had a history of mental illness or, had a little bit of anxiety. And I've seen a lot of this, people that call me and say, listen, I did well and I was a little anxious, but then since the pandemic, the social isolation, the lack of contact with people really got me really anxious. And so I think the numbers will be there. The question is, how many? And I don't think we know. I think we need to do whatever we can to prevent those numbers to be as high as September 11. But we're still in the middle of the pandemic, so I think it's early to identify the total numbers here.
So while some people are adjusting to normal life again very gradually, others aren't moving in that direction at all. Chris Segrin is a professor and head of the communications department at the University of Arizona.
It seems that there are two things that are likely driving this. One of them is habit, in that we've been socialized for the last 15, 16 months to understand the coronavirus as a danger and that we have to take steps to mitigate that danger. And that sense of trying to create a sense of safety is not something that we just turn off like a light switch. Those habits that have perhaps served us well over time are not easily relinquished.
Segrin agrees that many people are also slow to return to normal because of risk perception. They may feel like they're still in danger. People may be concerned about underlying health conditions that could intensify a COVID-19 infection, or they might still live with immunocompromised relatives.
After all, let's not forget that to this day, a very large number of our population is still unvaccinated. So the perception of that risk is not necessarily out of touch with reality.
And unfortunately, the reality for some people is that they'll have a longer psychological recovery ahead of them. Segrin says those who've had the most traumatic experiences during the pandemic will likely endure the most persistent and long-term effects.
What happens very often is that when people experience unexpected and traumatic outcomes associated with things like 9/11 or coronavirus, and I'm speaking specifically of people who've lost loved ones, who maybe otherwise were fairly healthy and it was not expected that they would be lost. Those losses, we all have to remember, those losses stay with them long after the virus is gone. There's many people who are on ventilators in hospitals and have weeks, if not months of their lives in intensive care. The recovery from those experiences is not going to be rapid for many of those people, and it may never fully happen for some of them.
However, trauma isn't the only predictor of lasting mental health effects from the pandemic. Seagren suspects that older populations, rural communities, and certain racial and ethnic groups may face heightened mental health risk, similar to demographic differences during the pandemic itself.
We talked about this number of 600,000 deaths. As we all know, the majority of them were in elderly population. So I think the other thing that's a kind of a double whammy for this particular group is they tend to be less mobile. They tend to have less often social connections. Those who are invalid or shut-ins in some ways before the pandemic, I think, put at a real disadvantage because for a lot of them, the little socialization they had would be like a lifeline, whereas for a younger person who had a lot of socialization, curtailing that a little bit probably wasn't as big of a deal. So I definitely think elderly folks, I think rural folks who live far away from community resources, they probably suffered more, I think, than people in urban centers. And then, of course, you have various racial and ethnic groups who seem, in some cases, to have disproportionately borne the brunt of the coronavirus in terms of infection and, in some cases, mortality even.
But even within those populations, some people are more resilient than others. Experts are suggesting a number of ways to improve your mood and mental health. Seagren says engaging with other people however you can, whether it's face-to-face, over the phone, or on the internet, all of that can help.
You know, a great way to feel better about yourself is to do something positive for other people. And so what I recommend to many people is if you have the opportunity to contact people in your social network, again, even if it's over the phone, email, however you do it, this is highly beneficial for most people. It's also the case that most people have pleasant and enjoyable activities. And what happens a lot of times is when they become depressed, they tend to drop off in the pursuit of those activities. What they need is a reminder to consciously engage in those things, whether it's your exercise that you do, a hobby, something enjoyable that you used to do that you may be finding you're not doing as much right now. Go back and start doing it again.
So where do we go from here? How can we roll out mental health supports on a large scale? Catherine Ettman is the Director of Strategic Initiatives and Chief of Staff at Boston University's School of Public Health. She says it'll be important to reduce the stigma around struggling with mental health and increase awareness of the signs and symptoms so people can get the help they need. Ettman hopes that as experts continue to monitor these trends, their research will raise that awareness.
Yeah, so we have some national estimates, again, from the CDC. They've been doing pulse surveys where they've tried to check in regularly at very high level symptoms of depressive disorder and anxiety disorder. And the data show that depressive symptoms and anxiety disorder stayed high. They maintained this high prevalence that we saw earlier in the pandemic, and in some cases increased, in some cases may have decreased, but overall these numbers have persisted. They have stayed high during that time. Now, again, our hope is that once the stressors ease, then over time, the poor mental health that we saw tied to those stressors would ease as well. But what the published data have shown us are that these high levels of depressive symptoms, of anxiety symptoms, they have been maintained and they may continue even now.
Nobody can say for sure how long COVID-19 will continue to impact our lives. Certainly for some, it will be years and in a variety of ways. If you're doing okay after 16 months of unceasing pandemic, that's an accomplishment. It's an accomplishment to reach out for help, too, if you need it or know someone who does. You can call the Substance Abuse and Mental Health Services Administration National Helpline at 1-800-662-HELP. That's 1-800-662-HELP. You can find out more about all of our guests and that hotline number again through links on our website, radiohealthjournal.org. Our writer this week is Scarlett O'Hara. I'm Reed Pence.
Supporting immune function through a healthy diet has become an important new focus for many people these days. One key recommendation is to eat more vegetables and fruits, such as grapes, every day to improve immune function. Combining grapes with vegetables can help achieve this goal in a tasty way, according to registered dietitian Courtney Romano, health advisor for the California Table Grape Commission.
Fresh grapes are heart-healthy and hydrating and linked to benefits in multiple areas of health, including supporting immune function. Grapes are always a smart snack choice on their own, and they also pair well with other healthy foods such as vegetables to enhance flavor and nutrition. Add grapes to a kale, spinach, or arugula salad. Roast grapes with cauliflower or broccoli. Combine grapes with cucumbers and feta for delicious and healthful eating.
Grapes from California are a natural source of antioxidants and other polyphenols. Visit grapesfromcalifornia.com for more information and over 300 recipes.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
For the first time, we are now able to get prices and know prices from hospitals up front before we get care.
A new regulation that could mean that you know what a hospital stay will cost beforehand.
Then, dog bites.
Don't come out saying I think pit bulls are like AK-47s, but I would also say that there is some inherent danger when you have a dog as part of your family that is fairly strong that could have some aggressive behavior when prompted.
All that and more on Radio Health Journal.